Good morning, and welcome to Black Women Organized for Political Action and our Training Institute for Leadership Enrichment and our Hispanic Organized for Political Equity Media Briefing to share our new polls finding on Black women and Latinas and the unique barriers we face in mental health care. And this is our call to action for greater equity in mental health provisions. My name is Desi Woods Jones, and I'm the state president of BWAPA Tile. BWAPA is so excited to partner with our Latina Sisters at Hope. A huge thank you to Hope CEO, Helen Torres, who will be joining us shortly, and to her team for the leadership and collaboration that will gender greater equity for our communities, our mutual communities. This is our empowerment call to uplift our community and each other, because of course, who else is going to do it if we don't do it ourselves? As a founding member of BWAPA, which was founded in 1968, we surely did not envision, with all of the things going on even then, the numerous issues that we face today. But we did know that we needed to ensure that there was equity across our communities, especially low-income communities, under-resourced communities, which have always seemed to get the short end of the stick. And those of us on this call know that. As you have heard many times, when the world catches a cold, when the world catches a cold, of course, of the Black and brown folks in the low-income communities, under-resourced communities, and others, we get pneumonia. And so we want to fix that if we can. I want to give sincere thanks to our Evictorous research team, whom I am so proud to call out, of our sister friend Shakari and her colleagues Angela. At this point, we would like to, however, thank our BWAPA leadership, Kelly Todd for her outstanding work. Also, of course, our executive director and COO, Lanice Jones. So at this time, I'd like to pass the mic over to Helen for her comments before we move on to give you our findings. Thank you and good morning.
Good morning, Denise, and thank you so much for your leadership. You are an individual that we all look up to and try to emulate as much as possible. So it has been a pleasure to be working with the WAPA in partnership and in true sisterhood. I want to ensure that Hispanas Organized for Political Equality always leads with a lens of equity and platform sharing to ensure that together we are addressing these common issues that are affecting Latinas and Black women across our state. And unfortunately, the issue of mental health, how it's addressed in our communities, how it's not addressed in some public institutions, has really been detrimental to the advancement of both Latinas and Black women. In this study, I think you will find that there is not only a call out for action, but really truly an opportunity to dive deeply into the research and understand from our perspectives as Black women and Latinas of the importance of taking care of our mental health, but ensuring that institutions are receptive to the needs of change so that they can service our communities. And as importantly, that we collectively work together to make sure that the policy recommendations and the change that is needed is happening. So with that, as Hope's leader and CEO, Helen Torres, just as a reminder, we welcome this conversation. We are thrilled to be partnering with BWAPA Tile. We are so thoughtful of this time that we're sharing together and the importance of showing unity in our communities and really coming together not only as leaders, but problem solvers and as advocates on behalf of women. So with that, I have the great pleasure of introducing the core sponsor, an individual that brought us all together because they identified the need in community. And that's the incredible Madeline Adams, Senior Director of Community Health at Kaiser Permanente. Thank you so much, Madeline.
Thank you, Helen. Good morning, everyone. I'm Madeline Adams, Senior Director of Community Health for Kaiser Permanente in the Northern California region. And I'm really happy to be here today. And I'm thankful for this moment that I can tell you a little bit about why this is so important. You've heard a lot from Desi and Helen, but we're so proud to support the work of BWAPA and HOPE. And the information you're going to hear today, because mental health issues are the most pressing health needs in the communities we serve. And as Desi said, when everyone else gets a cold, we get pneumonia, you better believe it. Our communities are hit harder and longer with almost every bad thing that can happen in any category. And we know with COVID-19, the pandemic took a particularly heavy toll on Black, Latino, Native American, and other communities of color, creating stressors, creating trauma, and our community needs more support. So I hope today you will hear more about what the community is saying about what is needed. The data and the voices that we hear from today will give us insights into the challenges that Black women and Latinas face when seeking and attempting to seek mental health care. We really hope this will inform how we do our work in the communities that we serve at Kaiser Permanente. We're also working on expanding career pathways. We have quite a few initiatives that are happening, and we are supporting what Hope and BWAPA are doing in some of their work to expand job opportunities within the mental health field for women of color. So this moment, this time is important. And as I think what Desi said, but maybe Helen, this is a call to action, and we need information before we can go act so we know we're doing the right thing. So with that, I'm going to make sure that I say thank you to all of you who have joined. Thank you for the work that you're going to do for our communities. I'm really looking forward to today's presentation and discussion. Thank you. You're on mute.
Thank you so much, Madeline. We so appreciate your comments and again, working with the support of Kaiser. So applause to you for your care and your concern and being great corporate citizens. So thank you so much, Madeline. It's now my pleasure to move us into the meat of this news briefing, and that is to bring on Shikari and her team of folks from Evictor who have done a phenomenal job in making sure that the information and the survey, the questions that were posed to our community members reflected what's really going on out there in mental health. And so one of the best teams of researchers in the state of California and the nation, it is my pleasure to present our dear friend and sister Shikari, who will present her team and information. Shikari, passing the mic.
Thank you so much, Sister Desi, and also to Lanice Jones, Executive Director of BWAPA, to Helen Torres and her team at HOPE, and to Kaiser Permanente for granting us this opportunity to conduct this important research. My name is Shikari Byerly, and I'm Managing Partner of Evictor. I'm the principal researcher of this study with expertise in multicultural, multi-generational, multilingual research, and specifically survey research methodology and health policy. I'm joined today by my colleague, Dr. Angela Ocampo, who's our senior research consultant and also professor of Mexican American and Latinx studies at the University of Texas, Austin. Her forthcoming book, Truly Home: The Politics of Belonging in Latino Political Incorporation, examines the notion of perceived belonging to U.S. society and its influences on political interest and political engagement among Latinx populations. I want to turn now to our topic today, which is equity in mental health. We are very excited to share with you and to amplify and elevate the voices of Latinas and Black women in California as it relates to mental health. As a state, we pride ourselves on our commitment to progressive values like equity, social justice, and investments that help ensure that all Californians thrive and have a good quality of life. We are the 5th largest economy in the world. We're home to the largest Latinx population and the 5th largest Black population in the country. As a state, we are uniquely positioned to lead the way in health and mental health equity. And this study makes the imperative of deep investment and action clear. The California Equity and Mental Health Survey collected insights from 800 Black women and Latinas, 400 Black women and 400 Latinas, each population represented equally. And we asked questions that covered a range of issues, including the most important concerns facing women and their families, their levels of access to mental health services, their preferences, and also barriers to seeking care, their priorities for approaches to creating greater equity in the provision of mental health care. Our presentation today covers some of the relevant literature on issues related to mental health for Black women and Latinas, and also details that these two populations, what they had to say about their own personal concerns, as well as the investments they believe are necessary to better support the emotional well-being and mental health of women within their communities. I would now like to pass it to Dr. Ocampo to review some of the literature and our results.
Thank you, Shakari. And thank you all for the opportunity to let us conduct this important research to BWAPA, to HOPE, and to Kaiser. So as we begin our discussion of the specific findings from our study, it is really important to underscore the multiple aspects that impact the status of mental health and well-being for Black women and Latinas. We know that Black and Latinx populations experience very high risks of emotional psychological stress that is exacerbated and compounded by multiple societal factors. Front and center is the consequential impact of the COVID-19 pandemic and the way in which it brought to light an unprecedented global mental health crisis. We also know that Latinx and Black Americans, young folks, women, and those with low incomes remain at most risk due to their unique positions as being burdened by the social determinants of health, which include education, housing, income, wealth, employment, social environment, and much more. Added to this is the layer of oppressive systemic structures that increase the burdens and trauma in communities of color. These include, but are not limited to, white supremacy, anti-Blackness, anti-immigrant sentiment, and hate crimes. All of this increase the burden that Black and Brown communities face. As the mental health challenges and needs of Black and Brown communities are evident, it is also clear that the mental health care system and the healthcare system overall are not well equipped to handle these specific needs. We know that co-ethnic providers are incredibly important in providing outcomes and improved experiences for racial and ethnic minorities. However, the healthcare system and the mental health care system have very little co-ethnic providers. In California, only 4% of active psychiatrists practicing are Latino, and only 2% are Black. The first set of results that I'd like to discuss is regarding issues that Black women and Latinas in the study report as their top concerns. We asked respondents to share with us what were the most important issues that were facing them or their households. We find that just over 1/3 of Black women and Latinas report finances and economic concerns related to having inadequate income. These also include, as reported by our survey respondents and highlighted on the screen, are inflation, gas prices, childcare, high cost of food, among other finances. We also find that in addition to these economic concerns, other top concerns that Black women and Latinas in California report include safety, health, and housing. These findings highlight the socioeconomic circumstances and the top concerns that exacerbate and directly impact the mental health care and well-being of Latinas and Black women in California. Our study also revealed that discrimination impacts the daily lives of Black women and Latinas in California. More than 3 in 4 women in California report experiencing some type of discrimination. Over 61% of women report that it is due to their race or their ethnicity. More than half of the women report that it is due to assumptions that people make about their income or their education. And almost half of the women report experiencing discrimination due to their physical experiences. Not only do women report how discrimination impacts their daily lives, but also how racism and the discrimination that they face really takes a toll on their mental health. Notably, we find that close to 70% of Black women and Latinas in California report that their experiences with racism negatively impact their emotional well-being and mental health. The impact that discrimination has on mental health of women is most drastic among some subpopulations. Black women and lower income women are the most burdened by the impact of racism on mental health. 39% of uninsured Black women report that racism and discrimination impacts their mental health a lot. 31% of Black women ages 42 to 56 and women with household incomes less than $50,000 a year report that racism impacts their mental health very much. Black women on Medi-Cal, Black women overall, and women covered through Medi-Cal overall as well also report discrimination as impacting their mental health quite a lot. Black women and Latinas also encounter unique societal expectations that heighten their mental health challenges. Research has documented the cultural stigma that Black women and Latinas face, including rooted cultural expectations such as the myth of the strong Black woman, or for Latinas, the idea of Marianismo, which is the idea that self-sacrifice should drive one's behavior and must supersede self-care, or the idea that familismo and that family obligations must be met before anything else, or fatalismo, which is the acceptance of God's will or fate at the expense of one's well-being or health. These cultural stigmas that uniquely are placed and provide challenges to women, these impact mental health and their willingness to seek help. In our study, we find that women report how expectations of their family roles as Black women, Latinas, as caregivers, as sisters, and as sole providers, as well as all the intersections of many of these, impact their daily lives and pose greater challenges for mental health and well-being. In the words of one of our respondents, a Black woman, age 52 from Stockton, she says, being a Black woman, single mother, and sole provider is hard. It gets even harder depending on where you live. People think the phrase strong Black woman is a badge of honor. It isn't. It's a label that means there is never anything wrong with you. Don't ask for help. Don't expect help. Deal with it on your own. We are the women who go unseen, unheard, and unappreciated. I will now pass it over to my colleague Shakari to take us through some of the concerns that women have in seeking care.
Thank you so much, Dr. Ocampo. We asked women to share with us if they had ever had a mental health concern for which they did not seek care from a counselor, therapist, or other mental health provider. More than 3 in 5 Black women and Latinas, 62%, report having a mental health concern for which they did not seek care. Further exploration revealed a number of barriers, including difficulty in finding a counselor, therapist, or mental health care provider who shares their values or comes from a similar background. This finding is notable because it pushes us to think about the multiple dimensions of identity and background that are important. While a majority of Latinas, and especially 3/4 of Black women, place a high priority on finding a co-ethnic provider, being a Black woman or a Latina, more specifically, they want a provider who shares their values, who can demonstrate cultural understandings. Other barriers included costs, broadly defined, that includes monetary as well as opportunity costs, including the length of time to an appointment, getting time off work, access to transportation to travel to the appointment, and also the risks that could be associated with care, including concerns about being overprescribed medication, fear of being misdiagnosed, fears that their privacy might be violated, or that treatment or care would not respect, account for, or be appreciative of their ethnic or cultural background. The survey makes clear that there are some segments that are disproportionately have higher unmet needs. This includes 90% of women without coverage for mental health care services, 74% of those with a mental health condition, 73% of those ages 18 to 41 are Gen Z and millennials, 69% of those who are second generation, they have immigrant parents or grandparents, 68% of women covered through Medi-Cal report untreated mental health care needs. In the words of one respondent, a Latina who's 32 years old from Oakland, she says, another hard part of getting started with mental health services is the amount of time it takes to find someone or the trial and error of finding one that's right for you. It's been very discouraging. After trying with my insurance provider, I just gave up. Another woman, Black woman, 56 years old from Vallejo, says, I feel that they won't really hear me. Just give me pills and send me on my way. There were a range of additional concerns, as you'll see on the next slide, that women shared with us in their own words. A 28-year-old Afro-Latina from Oakland shared her concern this way: time, money, availability, fear of escalation, so not able to be 100% truthful. A 52-year-old Black woman from Stockton said, fear of not being taken seriously, or they would use it against me to take my kids. Another Black woman, 33 years old, who lives in Richmond, said, cost and knowledge of the history of Black American trauma throughout history and how it truly influences our everyday living. A 61-year-old Latina from Van Nuys shares a similar concern. In her words, she would be more likely to seek care if a provider is fluent, compassionate, culturally aware of Hispanic multicultural needs per country and region. A 61-year-old Latina from San Pedro said she feared that a provider would share her information with other government agencies and it would be used against me. Women also shared poignantly concerns grounded in prior adverse experiences within the mental health care system. I'd like to pass it back to Dr. Ocampo to share some of those insights.
Thank you, Sha'Carri. In addition to the concerns that are present for many of the women in our study, we also find that women who have actually sought help or know of someone who has sought help, they have had adverse experiences, and these were shared with us. These range from misdiagnosis to a rejection of understanding the specific experiences that Black and Brown communities face. A 53-year-old woman from Los Angeles shared that there are a lot of mental health professionals who are incompetent and misdiagnose Black and Latinas at higher rates with serious illnesses when all they might need is cognitive behavior therapy in many cases. In her words, she says they reject the fact that oppression and extreme poverty is causing these communities a lot of mental anguish. A 46-year-old Latina from Dublin reports that she has had very poor experiences with therapists and counselors and has not found the majority of them helpful. An 80-year-old Latina from Los Angeles shares that she's observed friends that have gone to mental health professionals and they were worse off, more distraught than before. Either through direct or proximal experiences, Black women and Latinas in our study share powerful experiences that indicate the negative and adverse encounters that they've had with the mental health care system. In addition to exploring concerns, barriers, and personal experiences related to seeking care, we also share with survey respondents a number of disparities in mental health from recent studies. These disparities included disparities in rates of treatment by race and ethnicity more broadly, such as how in a recent 2022 study, of those who reported having symptoms of mental health issues, Black people were the least likely to receive care at 47% compared to 64% of white people. And in a 2021 study, more than 70% of Latinos who do access mental health services end up not returning after their first visit. We also presented our respondents with statements about disparities in rates of treatment for women, namely those eligible for public health services. We shared with them that 55% of Latinas and 52% of Black women who had recently experienced mild to moderate psychological distress and were eligible for public health services did not receive any treatment for their mental health needs, compared to 42% of white women. And lastly, we shared with our respondents statements about rising rates of suicide among young Black women and Latinas. We shared with them that according to a 2021 study, for more than a decade, suicide rates have been increasing in Black youth, with the sharpest rise occurring among Black girls. A separate report in the same year found that 1/3 of young Latinas contemplate suicide. We find that more than 4 in 5, or 80% of women, express high degrees of concern related to each one of these issues and disparities that we shared with them. Across the board, the women in SRD report very high levels of concerns for all of these disparities, as well as the abysmally low numbers of co-ethnic providers in the state of California. I will now pass it to Sha'Carri to review the recommendations that women shared with us to address these and other mental health care disparities affecting Black women and Latinas.
Thank you so much, Angela. One of the primary recommendations coming out of the survey is the high priority women place on expanding the pipeline of mental health careers for Black women and Latinas. 89% of Black women believe it's extremely or very important to have mental health care providers that identify as Black women. 78% of Latinas believe it is extremely or very important to have mental health care providers that identify as Hispanas or Latinas. There is also near universal agreement that investments must be made to increase awareness about the benefits of seeking help and support, which is connected to reducing some of the stigmas that Angela spoke about earlier in the presentation. Women also call for the expansions of programs for Black and Hispanic women, mentoring programs specifically for those interested in mental health careers. They place a high priority on expanding access to online, telephone, or virtual appointments, which may break down some of the barriers related to limited time off work or transportation or other access issues. And they call for providers that are trained specifically to understand and be sensitive to the diverse communities they are serving in those appointments. Finally, women also prioritize expanding the number of Latinas and Black women who are mental health advocates and navigators and promotores that can work through community-based organizations to help women get the equitable care that they need. Taken together, these results outline a clear set of action items for the state of California. Increase funding. The imperative is to dedicate more resources to reducing the risks associated with care and addressing those key barriers to care, such as lowering the costs, ensuring that the providers that are available actually accept a broad range of insurance coverage, ensuring that more women have coverage for mental health services, ensuring that we have investments so that women can get safely to and from care, so addressing those transportation issues, having policies in place that enable women to take time off work that accommodate for childcare needs and break down other barriers. Women also call for workforce development. This includes increasing the pipeline for Black women and Latinas in mental health care fields broadly defined through mentoring programs, scholarships, and financial aid. Broadly defining care providers includes leveraging trusted advisors. We know that the pipeline won't be filled tomorrow or today, but women need help now. So it's imperative that the state begin investing in increasing the number of mental healthcare advocates and promotores that can work directly through community-based organizations to help women navigate the system and increase awareness and break down stigma. Women also call for the state to expand awareness, invest in education among Black women and Latinas about the benefits of seeking help or support when facing stress, emotional pain, distress, and mental health challenges. I want to thank you for your time and attention to our results and our presentation. And I'd now like to pass it back to our moderator, who will facilitate our question and answer period.
Thank you so much, Shakari. I've dropped in the chat instructions to our participants to please go ahead and use the chat box to put forth any questions for the research team. At this time, we have no questions. Getting one question. There's a question from our participants. What was the most surprising finding in this study? And that's not directed to a specific person. What was the most surprising finding in this study?
I can start. One of the things that was pleasantly surprising is just the amount of consistency across both Black women and Latinas in the call to action and in the types of investments that each segment placed a priority on. I think this is particularly important during a time when we often hear about division in our communities. This study really underscores not only the common need, but the common call for both communities for the state to invest in increasing the pipeline for both Black women and Latinas. There's really one voice in the study, and I think that's important, particularly in this at this point in time. And Angela, I know, will want to share her insights as well.
Yes, thank you, Shakari. So I would say, you know, we mentioned two notable and I think surprising findings. And I think in many ways, I think like to point out just how much agency the women in our study kind of, you know, how much agency they exert and they have. So I think one of those ways is to really think about, as Shakari mentioned, the consistency, right, in their call for action, but also the extent to which, despite some of the adverse experiences that Black women and Latinas have had with the mental health care system, they are being proactive about it. So over half of our respondents across the board report seeing a counselor, therapist, or mental health provider for support with any issue related to emotional well-being or mental health, right? So they are seeking help, right? And I think this in many ways helps demystify this idea that that in our communities, that our communities are not proactive about their health. And so what we see here is that, you know, they report very high rates of actually, you know, going out of their way to contact the mental health provider. And then I think that the other surprising finding for me was the ways in which some subpopulations in our communities do have greater burdens and report greater challenges than others, and particularly unexpected subpopulations, such as Gen Zers and younger women compared to older women. And so I think that we would expect that because younger women would be less likely to feel hesitant, or there would be less of a stigma to talk about mental health or to seek help, we see that some of the challenges are actually greater for younger women, younger Black women and Latinas than they are for older women.
Wonderful. Thank you. We have a few other questions in the chat. There is actually a question in Spanish from Telemundo. Perhaps this may be for Dr. Ocampo. The question is in Spanish. It quickly reads, vi que los costos son parte importante del problema. ¿Qué tanto afecta esto para obtener ayuda en salud mental? ¿Y qué tipo de consecuencias puede tener en las mujeres no obtener ayuda? Anudando a las estadísticas, perdón, del suicidio que compartieron.
Gracias por la pregunta. Bueno, algo importante que yo recalcaría acá es que sí encontramos en este estudio que los costos, sobre todo el costo del transporte, es algo muy, muy importante en una barrera que las mujeres de nuestra encuesta citan como algo que las previene de buscar ayuda, ¿no? En cierta manera, algo a lo que me gustaría también regresar un poco fue a estos temas que toca al principio, que en cierta manera si diferentes barreras y diferentes retos se juntan, ¿no? Entonces, como que en cierta manera le agregan una barrera a otra barrera, ¿no? Entonces, es importante y es cierto que los costos, tanto como el costo del transporte y que el costo también del cuidado de la salud son una parte importante del problema, pero que estos también interactúan con otras barreras que ya en sí le hacen difícil a que las mujeres de nuestra comunidad busquen ayuda. En cuanto a lo del suicidio, la pregunta, en cierta manera nosotros compartimos estos datos sobre las proporciones de suicidio y esto es algo que no estudiamos en específico la relación entre el costo y estos índices de suicidio. Entonces, esta es una pregunta que en sí no podría responderle en base a lo que nos muestran los datos, pero lo que sí puedo decir sobre las cifras y las estadísticas que mostramos sobre el suicidio es que nuestras mujeres en la encuesta reportan una preocupación demasiado alta, los números son más altos del 90%, ¿no? Entonces, estas cifras son alarmantes y realmente son estas cifras que les dicen a nuestras mujeres que realmente se tiene que hacer algo en sí para mejorar la situación de la salud mental de las mujeres latinas, tanto afroamericanas como en el estado de California.
Thank you, Dr. Ocampo. Another question reads, based on your research and experiences, what do you think is the most auspicious path forward? And what are the most favorable and viable solutions?
I can take a shot at answering that. I think one of the good news is there are community-based organizations, there are trusted community partners already doing some of this work in the community. And there is just a great deal of consensus that women are calling for community mental health navigators, for promotoras, to be equipped with the resources that they need to facilitate the education, the support, and the awareness that is so critical at this time. And we're currently facing actually a budget surplus. And so there are resources there. And as Angela stated, as Dr. Ocampo stated, our communities are showing the agency that they want care, that they're seeking care, and it's the imperative of decision makers to really honor that commitment by investing in communities. That's something that we can do today. All other solutions, I think, are also quite viable. Building that pipeline of people that are not only psychiatrists, psychologists, therapists, but counselors. Caregivers that are equipped and are educated about mental health and how to provide support in a culturally fluent and culturally accessible way.
Thank you, Shakari. The next question is, what reasons were you hearing from respondents who say they had a mental health concern that they did not seek care for? What kept them from seeking that help?
Well, some of the barriers were very clear. Costs was one that was very prominent. So access to quality, affordable care, I think, is a critical investment that needs to be made, but also things like transportation and time off work and the ability to have childcare support. And when you think about all of the unique positionality of Black women and Latinas, their roles in the family, their roles at work. Many might be single parents or sole providers. It creates an added burden to actually go and access care. So ensuring that care is affordable, that people can truly access it, and taking into account not only the monetary cost, but the opportunity cost. How can we lower those opportunity barriers to care?
Wonderful, thank you. Dr. Ocampo, as a follow-up to the question that our participant asked earlier from Telemundo, If I may, cuando habla usted de los costos del transporte, ¿se refiere a costos para acudir físicamente a un consultorio por salud mental o simplemente para moverse a sus actividades cotidianas?
Gracias. Bueno, yo diría que son las dos cosas. En sí, el costo de transporte, nuestras mujeres encuestadas nos dicen que realmente para ellos es algo muy importante si alguna vez decidieran acudir a buscar ayuda para su salud mental, que el lugar esté cerca o que se pueda encontrar transporte fácilmente, ¿no? Entonces, esta cifra combinada con las otras cifras sobre sus preocupaciones sobre el costo del transporte y también sobre sus preocupaciones de esos tres temas que hablé durante la presentación, que son los temas más importantes en sus familias o en sus hogares. Combinado estos tres resultados, podemos decir que sí se habla de costos tanto del transporte para acudir físicamente, pero también el costo y cuestiones financieras del día a día de sus familias, de sus hogares y las cosas que están viviendo también en su comunidad. Entonces, dirá el costo en esas diferentes maneras.
Thank you so much. We have two more questions. The first one is, how can communities get more engaged with this work?
Well, I think, one of the first steps, and I'll welcome Angela's comments as well, is for community leaders to really look at the constituents that they serve and have a mind and an eye to how they can be of support. One of our findings is the disproportionate impact on younger women. When you think about the barriers to care and the percentage who have not sought care but have a need. So I think it's up to us as those who work directly in communities, but also as family members, as sisters, brothers, mothers, fathers, parents, to really be connected to one another and to be mindful of the support. Those who have a need may not always ask for care, may not always ask for support, right? So I think those of us who are aware of the need, we can have our eyes and ears open, but we can also encourage others to be more mindful and to be more sensitive to issues like anxiety, like depression, grief, particularly in the midst of COVID-19. The tremendous amount of stress that we face. And I think everyone has a role to play in breaking down the barrier of stigma and also offering, being an open ear, open heart for support.
Wonderful. Thank you, Sha'Carri. Does anybody else want to add to that? How can communities get more engaged with this work?
I would like to add to that. This is Helen with Hope. I think one of the key things that's so important about the partnership that we have with BWAPA is the ability as women leaders to advocate on behalf of our communities and being very straightforward with our elected officials, also individuals that are leading our public institutions, and sharing this information and advocating with our whole heart and mind to ensure that resources are being allocated correctly. We also have an opportunity to be watchdogs, quite frankly. We know that in the past, allocation of resources to support Black women and Latinas have been very much in need and has not been allocated adequately. So we need to ensure that we're advocating strongly and making sure that we're the watchdogs to ensure the implementation of those funds are going where they're most needed.
Thank you, Helen. The next question is, what can we do to ensure that Black women interested in being mental health, community health workers are aware of opportunities to do so?
I think, as following on what Helen mentioned, BWAPA and Hope have really taken the initiative with the support of Kaiser to start the conversation. And I think they have shown themselves to be willing and ample connectors through the programs that they sponsor, the training institutes that they sponsor on a number of levels. I think many people hear Black women organize for political action or Hispanas organize for political equality, and they just think politics. But these two organizations really are community connectors and community supporters, and are amassing the resources and calling for the investments that need to be made for their communities. So I would say look to organizations like BWAPA in particular, that has a specific focus on Black women, on how to get connected, how to get involved, and join the movement to really uplift and better support women in our communities.
Wonderful, thank you. At this time, we've gone through all the questions in the Q&A and the chat box.
Wonderful. Seeing there's no more questions, I invite our friends at BWAPA to maybe perhaps say some closing words, and I'll say some closing words on behalf of Hope. Thank you so much all for joining us. Thank you to our researchers, and how lovely to have this example that was provided by funding by Kaiser, an example of what we can accomplish together when we work together, when we're allies together. And I look forward to continuing the work in raising up the voices of Latinas and Black women across our state to ensure that we have fair representation, as well as fair resources, and importantly, that we all thrive and move forward together. So thank you all very much for your time, and I turn it over to our friends at BWAPA for their finishing statement or their closing statements.
Helen, thank you so very much for those words. It is truly remarkable when we work together, when we pull our resources and our efforts and our energy. We all have so much work to do, and I know Hope as well as BWAPA. And as Shikari said, we have been about this business for over 50 years and reaching out to Black women to be a part of decision-making tables where we talk about it. We can make sure our communities are benefiting for the resources that many others have been getting for years. And so we want to continue this partnership. We're so proud that Kaiser initiated and sponsored this coming together. It was an important, again, move for us to make. And certainly we look forward to our continuing working together. I think Shikari said it well again. It is up to us to make sure that we are advocating and representing those that do not have the voice or may be afraid to lift their voices. Maybe they don't know how to make sure that we're advocating on their behalf and on their own, in our community's behalf. So we are absolutely pleased about this partnership. I want to again thank Victorious for a wonderful research job that they did to bring this important information to the forefront. We thank all of you that have participated. I certainly want to reach out and thank the leadership of our executive team, our executive director, Lanice Jones, and the members of her team that continues to work with us. Lanice, thank you, Kelly, and the others that were part of this. And once again, we're delighted about this partnership at Hope. And this is just the beginning, my sisters. We are going to kick it off and do some other great things.
Absolutely.
We're going to continue to make sure that this works for us and our communities. Thank you all so much for participating. Thank you for those of us that joined us. We appreciate you and have a wonderful day.
Thank you, everyone.